Hi there, guys. This is George Fiaggio. Um, Today is our presentation, and the topics I like the heart, and I thought it would be kind of nice to know a little bit about the heart and what goes on in the heart, and especially in the arteries and uh, what occurs. And I found out that we have something, a disease thing called atherosclerosis, which is like the narrowing of uh, your artery wall and the capillaries, the narrowing through. Um, but this is not supposed to. Um, so Um, as we begin, so our discussion today will be atherosclerosis, not to be confused with arteriosclerosis, which is a stiffening or hardening of the arterial walls. Arteriosclerosis is the hardening and narrowing of the artery wall because of plaque buildup, usually from like heavy diets over time. Like, I mean, if you were to eat McDonald's constantly every day for like 2 months, breakfast, lunch, and dinner, I'm pretty sure you kind of fall under uh, in this category because it's a lot of fat and a lot of uh, what's it called, grease that built up. So let's go. So atherosclerosis. So as we know the heart pumps blood out of the body through the ventricles and through the arteries, and so like we have pulmonary circulation and all that. Um, so here I just talked about how arteries they are blood vessels that carry blood from your heart throughout your body. They're lined with the endothelium. So the endothelial epithelium could be found in the arteries wall. This serves two purposes. It helps gives it a defined shape, and it also helps promote smooth blood flow. Um, So, like causes and risk factors of atherosclerosis. Well, it occurs when there's like a damage to the endothelium. Then the causes are narrowing due to the plaque buildup gradually over time. Because like every single time that the blood flows through there, if like there's a lot of high uh, fat, like low density lipoproteins. We have low density and high density lipoproteins. The high density is the good one that is good for your heart, but the low density lipoproteins is kind of like bad, and it's kind of like built up slowly, and when it builds up over time it forms those plaques. um, Other things are the plaque build comes from high cholesterol, like I talked about. Like if you eat McDonald's every day, like you are gonna have a very high fat diet, and that is gonna not be good. High blood pressure also causes this inflammation from arteries, from arthritis. I mean, um, also people that are very extremely obese, and have or abdominal um, obesity, diabetic patients, um, who are obese too, and also stress can also help cause atherosclerosis over time. Shockingly, believe it or not. Smoking and not taking proper good care, proper hygiene, and people who are alcoholics, who have very high alcohol intake on a daily basis or on a weekly basis. Yeah. So moving on to the next slide. So some signs and symptoms of atherosclerosis would be middle-aged population over, so people typically over the age of 40, to mid 40s, 50s, like if they really didn't take good care of themselves when they were younger, will be experiencing some signs and symptoms. And some signs are erectile dysfunction, believe it or not, transient ischemic attacks, which is like micro heart attacks. It's like when the blood, like there's like a small tiny blockage or something, and it prevents the heart from like completely completing its cycle and stuff. So TIAs are like pretty severe, but like they occur in small spurts, so um, they are not major, and they don't hit you right away. The effects are not there seen right away, but over time they eventually cause a heart attack. And so if you have like some couple TIAs, you need to see a doctor, and they could put you on like blood thinners like Xarelto and things like that. So some symptoms. What I discovered was that they said they are related to the arteries that deliver blood to the brain. So obviously they are referring to stroke, which is one aspect that arteriosclerosis. Um, Also, we have numbness or weakness in the legs and arms, drooping facial muscles, paralysis, and also extreme severe headaches in certain occasions. Um, yeah. So, complications of atherosclerosis, I found out were aneurysms, which occurs in the brain when like you don't have enough blood supply to your brain because like the blood is not able to flow, or there's like clots, or there's like blockage. Angina, which is a very common symptom of complication of atherosclerosis, because you have like pain, extreme pain. The worst is if those plaques rupture in the arterial walls. It's like it breaks into the endothelium, and that could be very, very, like, very devastating. We also cause heart attack, stroke, peripheral artery disease, occurs in our external arms. So we go to um, so one thing of people with atherosclerosis, they have arrhythmia, which is unusual heart rhythms. So we notice this in them, and so people like this need to go see their doctor to see if they could get some treatment or some help. Treatment. So the best thing is preventative care. When you're young, you should be able to take good care of yourself, watch what you eat properly, and make sure you exercise, like heart healthy diets, weights, like eat good fibers, um, things that increase good blood volume, uh, and also people that want to like reverse things like this, that has okay, they can join like Weight Watchers and like weight loss programs, and they have like a point system that you can just keep track of like what you eat and stuff. So medications, like they like in the healthcare field, they use statins usually. So you see this in like the older populations, like geriatric patients, I mean. um so like a common one that is used like in nursing homes and stuff is atorvastatin. Atorvastatin. um and anticoagulants are also used, and cholesterol medication is also very, very efficient to prevent arteriosclerosis. So other forms of treatment are angiography, and stenting, where there's like they put a stent into your artery or something. Which is a medical procedure where a thin tube is inserted into an artery in the arm or the leg to target diseased arteries. Another really interesting procedure is endarterectomy. Um, which is a medical procedure where a doctor goes into the neck of the patient and removes a plaque uh, of the arteries to help restore normal blood flow and circulation. I don't have it here, but also they have fibrinolytic um, therapy, which is used in certain situations to kind of target this. Yeah, if you are interested a little bit more in it, you could look into that. Yeah, but overall, atherosclerosis is kind of like a serious kind of thing that we mostly need to pay attention to, because like every day we go about daily activities, we eat and but sometimes we don't pay attention to that, or like what we consume and stuff. So it's kind of important to kind of just make sure we uh, watch what we eat and what we ingest. Thanks. Okay, bye.